it's Black Maternal Health Awareness Week, which is fantastic, and I know that's why we're all gathered here. It feels to me as though every week should be Black Maternal Health Awareness Week, because that's what I believe. In New Jersey, we've had a lot of challenges, inequities in care, and when my husband came into the governor's office back in 2018, Black mothers were dying at 7 times the rate of white mothers. And Black babies were dying 3 times more often than white babies before their first birthday, which is completely unacceptable. So I'm really happy because while we were 47th in the country for maternal mortality rates back in 2018, we've now moved up to 27th. And we are going to really be the best in the country. I am personally committed to that space. We were the 2nd state in the country to expand Medicaid coverage 365 days postpartum, which is a really big deal because when women have died, more than half of those women die after delivering the baby, which many people don't understand. So expanding that coverage 365 days is a really important piece of this puzzle. But we actually have we created a strategic plan, and we have over 80 different steps to make sure that New Jersey is leading the way and not falling behind as we have done historically. And to date, we've already started or completed over half of those recommendations. So we are well on our way. We know exactly where we're going. We actually launched an authority, which is an Infant and Maternal Health Innovation Authority. It is the first in the United States of America. We in New Jersey are absolutely leading the way, and we are creating an innovation and health center in Trenton that will be akin to kind of the MD Anderson Cleveland Clinic of health and heart, but it's only going to focus on moms and babies. And we all love moms and babies. And to date, we've already passed over 60 pieces of legislation. So there's so much we're doing in New Jersey, and again, could not be done without every person in this room who is contributing their time and their energy to making sure that we are the safest and most equitable state in the country to deliver and raise a baby.
We recognize the terrible disparities and inequities in outcomes, and that we've been able to achieve very healthy outcomes and very low rates of poor birth outcomes and poor maternal health outcomes for white women in New Jersey, but that hasn't been the case for our Black mothers and even our Hispanic mothers. We recognize at days like this, weeks like Black Maternal Health Week, that there's no time to rest on our laurels, that this is really the driving force. It's made a difference, but we can't let up the pressure. We recognize how much a unified vision of a leader like Mrs. Murphy has really pushed our many agencies and organizations to think about their impact on pregnant people. We want to be number one for the best possible outcomes for every resident in the state of New Jersey, and that doesn't only require high quality health care and training for our professionals. It really is a whole community effort.